The information you will listen to in this video has been prepared by making use of the package insert of the drug. If the video is useful for you, you can like the video and subscribe to the channel for support. Flagyl, a drug from the Metronidazole group, is presented in 400 mg tablets. The active ingredient of Flagyl is Metronidazole. What is Flagyl and what is it used for? Flagyl is an antibiotic that is used to treat bacterial infections of the vagina, stomach, liver, skin, joints, brain and spinal cord, lungs, heart, or bloodstream. Flagyl is also used to treat trichomoniasis, a sexually transmitted disease caused by a parasite. This antibiotic treats only certain bacterial and parasitic infections. It will not work for viral infections. How to use Flagyl tablets? Take this medication by mouth as directed by your doctor. To prevent stomach upset, take this medication with food or a full glass of water or milk. The dosage is based on your medical condition and response to treatment. For the best effect, take this antibiotic at evenly spaced times. To help you remember, take this medication at the same time every day. Continue to take this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Tell your doctor if your condition lasts or gets worse. Flagyl is usually given for up to 10 days in a row. You may need to repeat this dosage several weeks later. What happens if I miss a dose? Take the medicine as soon as you can, but skip the missed dose if it is almost time for your next dose. Do not take 2 doses at one time. What happens if I overdose? Overdose symptoms may include nausea, vomiting, numbness, tingling, or problems with balance or muscle movement. Here are some things to know before using Flagyl. Before taking metronidazole, tell your doctor or pharmacist if you are allergic to it, or to other antibiotics, or if you have any other allergies. Avoid alcoholic beverages and products containing propylene glycol while taking this medication and for at least 3 days after finishing this medicine, because severe stomach upset, cramps, nausea, vomiting, headache, and flushing may occur. This drug may make you dizzy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Metronidazole may cause live bacterial vaccines to not work well. Tell your healthcare professional that you are using metronidazole before having any immunizations, vaccinations. Before having surgery, tell your doctor or dentist about all the products you use. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. This medication passes into breast milk. Discuss the risks and benefits with your doctor before breastfeeding. If you are prescribed the single-dose treatment, your doctor may direct you to stop breastfeeding for a short time after the dose. Possible side effects with the use of Flagyl include dizziness, headache, stomach upset, nausea, vomiting, loss of appetite, diarrhea, constipation, or metallic taste in your mouth may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. This medication may cause your urine to turn darker in color. This effect is harmless and will disappear when the medication is stopped. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. If the video was useful for you, like the video and subscribe to the channel. Share your views and experiences in the comment section. I wish you healthy days.